So as Jane said, I'm Sarah Wickham. I'm a consultant information manager and archivist. I'm a white woman in her mid-40s with brown curly hair, today wearing a green top and brown square glasses and a black headset microphone. And with a colleague, I'm delivering this project for the Chief Archivist in Local Government Group of the Archives and Records Association. Massive acronym fest. I won't use too many acronyms, but please pop something in the chat if I inadvertently use an acronym that isn't immediately apparent. So this is a participatory session because the project that I'm representing today really wants to hear from you. We're aiming to improve the culture and the processes and the experience of everyone involved in developing and receiving records. And this session is one of several by which people are contributing to forthcoming guidance on managing the records of care experienced and adopted people in England and Wales. I'm going to be using some slides to give information and to frame the discussions that we're going to be having in breakout rooms. The slides won't be circulated, but I will put links in the chat at the end and they'll be in the follow-up email so that you've got access to any information provided in the session that you can come back to. There's a QR code and a URL on the screen now. They work for the live session only on Tuesday, the 13th of June. If you happen to be watching the recording and want to contribute to the project before the 31st of July 2023, please see the separate QR code and link on the webpage where you're watching this video. So this link will only work during the session on the 13th of June. So today's session will start with a quick tech check and some introductory polls using the page that opened when you scanned the code or entered the web address. And I realised that I didn't ask you please to scan the code. So if you haven't done that now, please do scan the code on your other device so that you can join in, and you should be able to see the slides on your small screen. But I'd recommend that you use your larger screen for any of the watching and then switch to your small screen when it's participatory. So I'm going to talk very briefly about the project that brings me here today. Huge thanks to the team at Core and BAF for this opportunity and for your wider support of this project. In about 15 minutes time, we'll go into breakout rooms for about 20 minutes, and I'll give a bit more information when that time comes. The breakout rooms won't be recorded, but we will be feeding back when we reconvene. And again, I'll tell you about that at the time. We'll be going into breakout rooms again and then coming back together to close the session by 1 o'clock. Because of the number of people today, thank you very much, I'm using tech interaction to collect information. When you interact on your device, I'm only capturing what you type. I'm not secretly collecting any other information in the background, just what you give me. And I can see already that people are voting on one of the most important questions of our time. Does pineapple belong on pizza? So if you haven't already, please let us know what you think. And you'll need to press the submit button at the bottom of your screen for your vote to be recorded. And so far we're evenly split between pineapple, yay or nay. So that's just a little practice so that people can get used to using AHA slides or Mentimeter, which is something else that you may have used. So I'll just give a couple of minutes for anybody else to catch up with that. And it looks like the results are in. The noes have it by a fraction. So
Sarah, sorry, there's a few people saying in the chat, can you just go back one to the QR code so they can have another go at scanning it,
that's
please?
fine. It should be there at the top, but I will just jump back.
Oh, it is. It's right at the top of the screen too. Yeah. And if you haven't got a specific QR code scanner, then it sometimes works with just your camera, people. So if you just point your camera at it as if you're going to take a photograph of it, that may work. Sorry, Sarah.
No, that's okay.
It'd be good to get as many as we can along with us.
Absolutely. There is the option of opening a link in the browser, and again there should be the URL at the top of the screen, which is hidden for me by my Zoom controls. So there may well be a URL that you can use. Okay, so let's go back and see what everybody thinks. Still, the consensus is pineapple. No, thank you. Okay. So it looks like quite a few more people have now been able to vote. So has everybody been able to participate that would like to? You can use a Zoom thumbs up. Okay, so the URL and the QR code will stay on the top of the screen as we move on. So I'm going to move on now. Thank you very much for doing a little test. Some late finishes for yes, pineapple does in fact belong on all the pizza. So there we go, it's definitive. Okay, so a little bit more seriously, it would be really good to get a sense of the people who are here. Please do let us know where you are joining from. And it looks as though people have been able to find their regions. Is there anybody in the east of England or elsewhere in the British Isles, or indeed outside in the British Isles? You may not have been able to find your place very quickly. So big shout out to fellow Yorkshire people. I'm currently in the Pennines in West Yorkshire. Bore da ffrindiau. And everybody is very welcome. Thank you very much. Awesome people over the Pennines, morning. Okay, thank you very much. That's really helpful. And I'm just going to move on and get a sense of the area of work that the people who are here this morning work in adoption, in care or fostering, in both, or in something else. I'm sorry, I'm not capturing absolutely all the possible roles and values that there could be. So lots of people working in adoption or in both adoption and care and fostering. Lovely. Thank you. A couple more people just voting. That's great. Thank you very much, everybody. I've got about 51 people who voted, which feels about right, given that there are some other people on the call who are administering the event. Okay, so I'm going to move on now. So thank you very much. It's really good to get a sense of who the people are that are here today. So I'd like to start by talking about what this project is, and what better place to start than to hear from some of the people who were in care as children. Well, there are more than 400,000 people living in the UK who were in care, and every year about 4,000 of them request access to their records. So I'm going to start our session by showing part of a video from a project called Mirror. And in the video, 8 care experienced and adopted people talk about their experience of accessing their records. I'm going to put the video link in the chat so that you can watch the whole thing after the session if you'd like, because this is just an extract. So if you can bear with while I find the place where I want to start and put the subtitles on. We'll be watching the video for about 2 minutes.
I left care at the age of 16, and it was in prison where I heard about my care files.
I was a youth worker at the time. I had no idea before then that the local authority has got information about me and my time in their care.
I was in my 20s and I'd not heard that I could access care records.
So when I found out I could apply for my file, then I immediately wanted to apply for that information.
I just wanted to try and put some of my memories back together because it became all jumbled up.
I had some gaps in my history, gaps in my life that I wanted answers to, needed filling in.
I did want to see, like a little pattern of my past and see, how it was written.
I I think it was probably quite more traumatic than I thought it would be, even going through the process of contacting people to access the records.
It's meant to take a month, and in my case, it took over a year.
The early impact on receiving my file was hugely emotional.
It was a lot to take in one go. I'd gone from a stage of not knowing the file existed to suddenly being presented with years and years of my life in care.
I found it very upsetting, and I know that some people who've accessed their files are sadly no longer with us because they couldn't bear the information that they read.
I found that it was more years down the line that it really affected me.
There's so much emotional stuff that overwhelms you. You do need to put it down at some point and come back to it when you're emotionally capable or emotionally ready to deal with that.
So I'm just going to pause the video there. I've put the link for the full video in the chat so that if you'd like to watch the whole of the 6-minute or so video, then you can do that later on. So the MIRROR project, Memory, Identity, Rights in Records, Access, MIRROR, was part of the impetus for the current project. And with input from practicing information managers and archivists, the shift from paper to digital and earlier microfilming initiatives is also a critical concern. You'll all be aware that recent reviews like IICSA and McAllister have made recommendations on records, and indeed in Scotland, legislation on retention of records was changed in 2011. And being archivists, we're also aware of occasions. So the upcoming centenary in 2026 of the First Adoption Act also gives particular impetus to this project now. So the Chief Archivist in Local Government Group got funding from the National Archives and also contributed funding themselves for this project to build on earlier work. And as well as the project board, a group of care experienced and adopted people is advising the project. And so this is what the project is doing. We're currently conducting a survey of records relating to looked after children and adopted children in England and Wales, both historic records and current, what there is, where it is, what formats it's in, administrative changes affecting custody of records and so on. So we're interested in current organisations as well as historic records. Now there are some other sources like Adoption Search Reunion, which is run by Coram Bath, although this doesn't cover care records. And some of you may be aware of the Children's Homes website, which doesn't include information about adoption or details of records and is run by a private individual. So this is a new data set reflecting the current position in 2023. After many recent changes to providers of care and adoption services and many changes in record keeping over the last couple of decades, including implementing digital record systems and lots of cataloguing of historic records. So a massive thank you to anybody here who is involved in responding to the survey. Knowing where records are is critically important. And then using this as an empirical base, we'll be producing guidance. The guidance will be informed by care experienced and adopted people, by social workers who create and manage the records, by information managers, archivists and information governance and data protection people who provide access and preserve the records in the longer term. The majority of today's session is to hear from you as to what that guidance should address. So I'm going to invite you to reflect on what you heard in the video and on your own experiences. And we're going to discuss the practical challenges in the breakout rooms. So in a moment, we're going to open the breakout rooms. You're going to have around 20 minutes in a group of about 5 people. There'll be a reminder before the rooms close automatically and bring everybody back into this main space. And I'm going to ask if one person per room could pull out the top 3 challenges that the room identify. And the slide is going to change towards the end of the breakout session so that we can share these together in the wider space. So very soon we'll be going out into the breakout rooms. I'd like you to think about what you heard in the video, what you know from your day-to-day work, And I'd like your room to identify the top 3 challenges in relation to the records of care experienced and adopted people. And still some rooms reporting. So it looks as though everybody's now back, and several of the rooms have reported and others are still typing. So we'll just give them a minute or so to finish reporting back from the breakout rooms. Quite a few issues raised about historic records and how things were done in the past that are now immortalised and captured in ways that we wouldn't do now. Lots of things about organisational change and things moving around. Delays because we're relying on other people to do things or for things to feed through. Long waiting lists because there aren't the resources to be able to do this part of the work compared to all the other things that there are. Lots of inconsistencies. I'm going to scroll down now so that we can see the bottom half of the screen. So very patchy and different experiences across the country, different experiences between the type of organisation that's being accessed and different experiences about the level of support that is given, either required or on offer. So again, issues with historic records about language, queries about redactions, what's appropriate to be included, how to hand over records, a lack of training for people and capacity in being able to do the kind of job that one would like to be able to do. Differences between the experience for care experienced people and adopted people. Timeframes if the requests are being treated as subject access requests. I think that must be what DSAR, data subject access request, means there. Lots of redaction coming up and what to share and that's subjective. Legal release of certain categories of information. Low levels of support for people accessing. And helping people with the processes, knowing that they can access the records and how to go about that, and then the processes around enabling that. And here we are. The way that records were kept in the past doesn't add value, or there's perhaps a lot of volume but not much content. Differences among courts. Local authorities not holding records when they should, knowing where to go in the first place and signposting. And still information coming in. Thank you very much, breakout rooms. There's a lot of really, really high quality information there. And I'm just going to leave this screen because there is still a couple of people typing. So I'm going to leave this slide on to give them a chance. Any surprises there? You could pop something in the chat if there are any surprises. And a couple of queries. Room 6, have you been able to feed back? So no surprises. Let's just scroll down. Still people typing.
Yes, room 6 have.
Room 6 have been able to. Thank you.
Yeah.
Thank you, room 6. Thank you, everybody. Okay, so I'm going to give another 30 seconds or so, and then we will move on, because I'd like to consider the guidance that the project is aiming to pull together.
A comment in the chat, Sarah, saying there's no surprises, as these seem to be the same dilemmas faced in 2002 when I was working in a post-adoption team. Yep.
And I think I saw on one of the breakout rooms post-it notes or whatever you want to describe these boxes, there are some new issues because of the digital records and record keeping systems that have kind of come in that last the last 20 years or so. Okay. I'm going to ask anybody who's still typing, if you could come to the end of your sentence, please, and hit submit. And then that will give us time to move on. Thank you very much. Okay. Thank you, breakout rooms. That looks like some really fruitful discussions. Alas, no surprises for some. Lots of similarities. So let's move on then to thinking about the guidance that we're aiming to pick up and address some of these practical challenges. So before the consultation sessions, of which this is one, our project board and our advisory group had already identified these detailed topics for the guidance: access to records, digitisation, longevity of digital, redaction, retention periods, storage of paper records, and other things. Could I invite you all to let me know the relative importance of covering these topics in the guidance? You should have some sliders to be able to rate these different topics. So I'll let you start to do that, and then again press submit, and we'll just take the temperature. I don't know if that's an appropriate metaphor to use in the current heat wave, but to see what that looks like. You'll need to use, there's a few people I think trying to vote on the screen. You'll need to use your device and the sliders to vote, and that's it. The votes are starting to come in. So we'll just give everybody a chance to express their opinion. And if you're choosing other, when the slide moves, there'll be a chance to tell me what other is. So hold on to that thought, make a note of it, or jot it down, and then you'll be entering it onto the next screen. Thank you, everybody. So voting rate seems to be slowing down, so hopefully nearly everybody has been able to contribute. So let's just have a look at what the room thinks. So access to records has perhaps unsurprisingly come out as being the most important thing for the guidance to address. You can see that virtually everybody had that as a very, very important thing to include. Digitisation, perhaps slightly less important, but still up there. Digital is obviously worrying people. Redaction, maybe, again, no surprise that that comes a close second after access, because the two things go together. Retention periods, so we're going to be thinking about that in a moment. So again, coming out as pretty high importance. Storage also of quite high importance. And then a few things for other. So we'll have a think about what those other things are as we move on to the next slide. So thank you for sharing thoughts on the importance of those topics, and let's see what's missing. So if you voted for other on the previous slide, you should have a chance to type things in, and I can see people are typing straight away. Thank you. And then everybody else, as you see these other suggestions appearing, you should have the option to vote to say, oh yes, this is important for me as well. So you have got some votes that you can allocate to these different topics. So please, if there's something that you think, oh yes, actually, I would have said that if I thought of it on the previous slide, please do vote and add your endorsement to that. Great. So if you can see something on the screen that you think as well, you can use a vote rather than typing in again. Lots of people saying support and legislation and sharing between local authorities and independent foster agencies, supporting family members as well as the adopted or care experienced person, information about how records were kept and used. So do add to what your colleagues have said. You can vote on these different ideas, or maybe that's too difficult to see. So we'll just go with everybody typing. So support, original documents, legislation, clear guidance on incorporating health information. Thank you for that. Funding, pace the delivery. Oh, so the process by which people are supported. Timescale like data subject access requests. Adoption post-commencement guidance. Thank you. Anybody still to add? Ending delay and prompt response. What should be stored on what files? More votes for legislation and support. Proper resourcing. So while we're just hearing from the last few people, I should have said that it's not mandatory to say other, but it's great that there are so many other suggestions coming in. Thank you. That the project board for this particular project by no means sees the survey of records and the guidance as the end. There's quite a lot of lobbying and other work that needs to go on. This is a problem that is greater than any one service or any one person. So all of this feeds into what might come next for this project. Couple of queries in the chat, but have people been able to do what they need to? My apologies.
Just one query about voting, but I think that's next, is it?
It is. So let us move
Thanks,
on, and actually I think we can probably skip that because this would have been the place to start voting on support, but we stayed too long on the previous screen. So we've got lots. I will just count up the number of times that people have typed support and all the other things that have been suggested. I was hoping to be able to aggregate that, but my apologies for not doing that very smoothly. So I'll just jump on then. Oh, it looked as though some people have been able to vote. So have we grouped up? Here we are. So some people have been able to kind of endorse. So I will amalgamate all of this information so that we can see the number of kind of votes for legislation or for additional support and that kind of thing. So I recognise that this screen has got a little bit long and is probably getting a bit difficult to navigate. There's also somebody still typing, so we'll just give you a moment. So if there's anything still out there that hasn't yet been said, you've got another minute or so to to feed that through. Okay, thank you everybody. That's really, really helpful to see and to have such clear input on what needs to come. So medical and health has been mentioned a couple of times. Thank you. Okay, so in a moment we're going to go back out into the breakout rooms, because we'd like to think for the end of this session, as we move towards the close, about retention specifically. So at the moment in England and Wales, the minimum statutory retention periods are 75 years for care case files and adoption case files before that December 2005 cutoff, and then 100 years for adoption thereafter. So these are the minimum statutory retention periods, and they cover those people who are formally classified as looked after. So some care experienced people are omitted from the legislative provisions at the moment. Some organisations choose to retain records for longer, including permanently. And where they do this, obviously, it's justified and publicised through their data protection policies. And we should just note that UK data protection law does include provisions for archiving in the public interest. So the project is interested in what you think about these current minimum statutory retention periods. So in the same breakout rooms and with the same arrangements as before, but perhaps a different volunteer this time, please could you have a think about what you think the situation should be? And again, we'll reconvene and reflect together afterwards. I will leave the slide on screen with the minimum retention periods on so that you've got that to refer to. So the core and BAF team will be sending people out into the breakout rooms, and I will just move the slide back. So the breakout rooms are closing and I can see people coming back into the main space. Welcome back. Looks like everybody's back and a couple of rooms still typing. There's a very, very clear consensus here from today's session about how long records should be kept. I did make this a voting slide, but that was an error. I didn't need to do that. So we can see that virtually all the groups are saying longer, forever, permanently. There are other people who are also involved in the records, and that it should be the same for care experienced and adopted people. Shouldn't destroy, forever, longer than 100 years, permanently the same, descendants need forever. Thank you. I allowed a little bit of time to kind of have a look at the different responses from the breakout rooms, but I think there's a really, really clear consensus on screen there. So thank you very much, breakout rooms. Oh, I didn't mean to blow one up. I meant to just scroll up to the top of the screen. Okay, I can see somebody is still just typing. So while the last person or last room is typing, I'll just talk very briefly about what happens next this morning and what happens next for the project. So first of all, huge thank you to people for coming today, for participating and for sharing your thoughts and opinions. What will we do with these? Well, there's other consultation going on at the moment with some other different groups. So care experienced and adopted people, including specific consultation with younger adults in both of those groups. There's consultation with information managers and archivists and with information governance and data protection practitioners. We're going to be working on the guidance over the summer, drawing on what everybody's told us. It'll be published in the autumn. And with your permission, we'll contact you to let you know when the guidance is published. The record survey, and for anybody watching this recording, the chance to contribute to the shaping of the guidance will close in July. I'm going to move on to the that slide. So the record survey closes in July. This consultation process closes in July. We'll be working on the guidance over the summer, and it will be published in the autumn, and we'll of course let you know when that comes out. I've put links in the chat to the video that we saw earlier on and some other information. And here is the link to the project, which I think I've just sent as a direct message to somebody in my haste. There we go. If you'd like to share anything directly with me following this session, then my email is now on screen. If you could do that before the end of July, that would be really helpful. Thank you very much. We've got a few moments for questions or for any reflection, if there is anything that anybody would like to raise. So I'm going to stop sharing. I think that the slide should stay where it is. So it will stay there on your device, even though it will vanish from the main screen. So I'm going